Kidney function involves filtering blood, primarily through structures called glomeruli. When these glomeruli are damaged, symptoms manifest. Different types of damage lead to different kidney problems and signs, which is why we distinguish between nephrotic and nephritic syndromes. Let's explore their primary signs, symptoms, common causes, and treatments. Nephrotic syndrome. First, let's discuss nephrotic syndrome. The main hallmark of nephrotic syndrome is the massive leakage of proteins into the urine from the blood. This makes the urine foamy or frothy. A daily protein loss of more than 3.5 grams per day in the urine strongly indicates nephrotic syndrome. The second characteristic is a decrease in protein levels in the blood, known as hypoalbuminemia. The third noticeable sign is swelling and edema, particularly in the legs, feet, and around the eyes, which is often most prominent in the morning. This swelling occurs because the loss of proteins decreases the blood's ability to retain water, causing fluid to leak into the tissues. Fourth, the body tries to compensate for the protein loss by producing more fats in the liver. These fats can also bind water molecules, leading to increased fluid retention. This results in elevated levels of fats in the blood, a condition called hyperlipidemia. Finally, these fats can also leak through the damaged kidney filters, resulting in fat globules in the urine. Under a microscope, these can be seen as oval fat bodies. Nephritic syndrome. If the main characteristic of nephrotic syndrome is increased permeability of the kidney's filtration system, the main characteristic of nephritic syndrome is inflammation of the glomeruli. The first and most important sign is hematuria, or blood in the urine. This occurs because inflammation and damage to the glomeruli allow red blood cells to pass into the urine. Microscopically, we can see dysmorphic red blood cells, known as red blood cell casts, which indicate glomerular bleeding. This blood in the urine may be visible to the naked eye but is more commonly detected microscopically. The second common sign is reduced urine output, known as oliguria, indicating impaired kidney function. If daily urine output is less than 400 milliliters, it is considered oliguria. The third sign is azotemia, an increase in nitrogenous waste products like urea and creatinine in the blood, which also points to filtration problems. The fourth sign is hypertension, high blood pressure. When the kidneys can't filter blood effectively, blood volume increases, raising blood pressure. Additionally, reduced blood flow to the damaged kidneys triggers the renin-angiotensin-aldosterone system, further increasing blood pressure. Edema and swelling are also characteristic of nephritic syndrome, and sometimes, though not always, protein is present in the urine. Generally, nephritic syndrome is more aggressive and often presents with acute symptoms, while nephrotic syndrome is more common but tends to be milder and more chronic. Now, let's discuss the most common cases in which each of these syndromes develops. Nephrotic syndrome. Minimal change disease. This is the most common cause of nephrotic syndrome, especially in children, accounting for 90% of cases in this age group. The exact cause is unclear, but it is likely due to immune system dysregulation, leading to increased glomerular permeability. Symptoms include classic nephrotic syndrome features: proteinuria, swelling, hypoalbuminemia, and weight gain. This disease is usually not aggressive and is well managed with a course of corticosteroids, often resulting in long-term remission. Focal segmental glomerulosclerosis, FSGS. FSGS involves damage and scarring of the glomeruli, leading to increased permeability. It is the most common cause of nephrotic syndrome in adults. Causes can include obesity, medications, or it may be idiopathic. Treatment involves corticosteroids, and if there is no response, immunosuppressants and ACE inhibitors or ARBs are used to decrease proteinuria. A low-sodium diet is recommended to reduce swelling. Without effective treatment, 50% of patients may develop chronic kidney disease within 5 to 10 years. Diabetic nephropathy. This occurs when long-standing high blood glucose levels damage the kidneys over time. Initially, it does not cause nephrotic syndrome, but in severe cases, it can develop. Diabetic nephropathy is the most common cause of chronic kidney disease and end-stage kidney disease. Other diseases, such as systemic lupus erythematosus and membranous nephropathy, can also cause nephrotic syndrome. Nephritic syndrome post-infectious glomerulonephritis. This often occurs after a streptococcal infection in children, such as a sore throat. IgA nephropathy. This condition involves antibodies being deposited in the glomeruli, causing inflammation and progressive kidney damage. Rapidly progressive glomerulonephritis, commonly caused by autoimmune diseases like Goodpasture syndrome and lupus nephritis. Treatment principles. The main principle for treating both conditions is to address the underlying causes. However, specific points for nephrotic syndrome include ACE inhibitors or ARBs. These are used to reduce proteinuria by decreasing pressure in the glomeruli. Diuretics. Loop diuretics like furosemide and thiazides help manage edema. Dietary adjustments. Limiting sodium intake helps reduce fluid retention. A low-fat diet and statins can be recommended for hyperlipidemia. Anticoagulants. These are used when there is a risk of thrombosis. Corticosteroids and immunosuppressants. These are used in cases of autoimmune diseases. For nephritic syndrome, treating the underlying cause is crucial. Sometimes plasmapheresis is used to remove antibodies from the blood, replacing the plasma with donor plasma free of antibodies. All the symptomatic treatments mentioned above can also be used for nephritic syndrome. Regarding protein intake, a balanced approach is essential. While replacing protein loss is important, excessive protein intake can worsen the kidney condition. A daily intake of around 0.8 grams per kilogram of body weight is recommended.